impact of vaccines in general, domestically and globally, to put it into the context of where we are now with COVID-19. Next slide. If you look at this slide, it is really striking. It lists the important diseases on the left that used to be extraordinarily important and impactful public health problems here in the United States. And in the second column is the estimated annual average number of cases prior to the vaccine for that particular pathogen. And look at the 2020, namely last year, reported cases of each of those diseases. The far right column shows that anywhere from 97 to 100% diminution in the number of cases purely as a result of vaccination. Next slide. Look at that from a different perspective, namely, what are the benefits in disease? So among children born in the USA from 1994 to 2013, these routine child vaccinations prevented an estimated 322 million illnesses, 21 million hospitalization, and an extraordinary 732,000 deaths, with a net savings of close to 300 billion in direct costs and over $1 trillion in societal costs. Next slide. Now look at it globally throughout the world, not only in the United States. 50 million deaths from 10 pathogens were averted by vaccines given just between the year 2000 and 2019, with some of the prevalent diseases shown in the second bullet. Next slide. That's all good news. But what about the sobering news of the underutilization of potentially life-saving vaccines? If you look at the estimated annual deaths globally for diseases that are vaccine preventable, you look at what can happen when people, and in this case, it's almost exclusively not vaccine hesitancy, but vaccine lack of availability in certain regions of the world. Look how many people, mostly children, who die of vaccine preventable diseases if they would have been vaccinated. 1.2 million for pneumococcus, over 500,000 for hepatitis B, and down the line with rotavirus, influenza, pertussis. And remember, these are vaccines that could have prevented disease and death, but were not accessible to these individuals. Next slide. And so if we look at where we are right now, as you've heard, about 6.67 billion people have received COVID-19 in the United States. We have over 400 million doses that have been administered. So what is the obvious lesson in all of this? As emphasized by Dr. Walensky, last slide, we have 66 million people in the US who are eligible for vaccine and are not yet vaccinated. You've seen in the slides I